things going? Any thoughts?
I hate Thanksgiving.
How was Thanksgiving? Yeah.
It totally blew it. And then, you know, it's so hard to get back on again. That, then I got depressed because I wasn't putting that food well, which made me want to eat more. So I was gonna, today I just kind of, that's it, back to 1,200 calories. And I'm skipping Christmas.
You know, that's one of the things is that when you feel like you're losing momentum, you feel like you've let yourself down,
Yeah.
self-sabotage behavior. And that's what Week 9 is actually, talking about the things that we do and how we lose our momentum with things and then you just give up. And so that's what you want to do different this time when you're making your efforts and going after your goals, is not lose that momentum. And, you know, when you have that piece of pie, just say, hey, this is life. I'm going to have a piece of pie, and it's okay. And tomorrow I'll make different choices. And, you know, when you have that pie, just have smaller bites of that pie, you know. So Christmas comes, have some pie or cookie, you know.
Just limit myself.
Just limit yourself.
I think that was, I tried to resist. And then when I stopped, it was just, yeah, so maybe just have a little bit.
Yeah, absolutely. The rule of thumb that Michelle Berger uses is keep your portion size as small as the calories that you, or as the weight you want to weigh. So if you want to weigh 150, keep your calories for your treat or your snack less than 150 calories. And so that way you can still have a couple pieces of pie and enjoy things. And, you know, it's all about substitution too. So if there's alcohol there and, you know, you don't want the calories of the alcohol, you could have a sparkling water or, you know, fill up on the veggie tray first and then have, you know, the other snacks or whatever. Just being mindful. So
I find if I am craving something, if I don't have just a little bit, whatever, it just goes crazy.
It does.
You just like become obsessed. So I'm better off just eating a little bit, because before it gets out of control in my mind, you know, when you can't think of anything else. It's better if you
That's
do.
a good point. Yeah.
You know, I was reading an article, it's been a long time ago, that Dolly Parton, she keeps whatever she likes to eat in her house, and if she wants a bite of it, she will go and eat a bite, but she doesn't go crazy. She doesn't overindulge. So she just eats a little bit of whatever to where it just knocks the craving out.
So it's not building up in your mind.
Right.
That's all you can think about. Yeah.
Right.
Because that's, I mean, at least I do.
That's
you
what I
just
did
get
all
it
the
to
time with
be.
that pumpkin pie.
Yeah. I do that too.
You're better off just having it, well, I'll just have a bite of it, or I'll have.
Yeah, thank you.
Because then sometimes it's not near as good as what you thought it was going to be anyway.
Especially if it's, if you start assessing, is this really worth the calories? You're like, no, not so much. And if you can really just get mindful with that. Yeah. It's I think of it more as a marathon than a sprint. You know, you want to enjoy your life and have those little moments. And I mean, that's what I do. And then sometimes I mess up and I eat the whole pie, you know, and it's okay. And then tomorrow you just do better and you make better choices, and you know, then just do the best you can. While we're on that subject, this is kind of a fun little thing. This was my Facebook post. This is why the fat thing is out here. Okay, crazy tips for weight loss. One thing you can do is set a timer and get up, because sometimes when you ever like finish a meal, you get up and you think, oh, I'm so full, I didn't realize I was so full. So just getting up and walking around. But a variation on that is to get up and brush your teeth, because once you get that, you know, toothbrush feeling, you don't really want to eat anything after that. Right. So you can set a timer for like 15 minutes and then at least get up and walk around, and then if you want to go brush your teeth, then you're less likely to come back. Tip number 2 is get grossed out. Make the food left on your plate look unappetizing. So you can put your silverware handles, you know, backward in your food plate. I'm kind of a diva with my food. It's about presentation for me. I think that's why I've never liked leftovers, because I like it to look pretty when I'm eating it too. wad up your used napkin and toss it on the food. Buy a fake fat glob and sit it on your table while you're eating. And I actually have a link to a website you can buy these. These are like $25, and you can keep that on your table and you take that home. You can put a picture of yourself at your heaviest on your refrigerator as a reminder you're watching calories. Wear your clothes too tight to dinner. One of my Facebook posts, I said, eat your Thanksgiving dinner in your bathing suit. You'll know real quick how full you are instead of wearing your, your fat bands.
Nobody else would eat it.
That's true.
You'll be helping everybody else too. That was funny because oh gosh, this is embarrassing. I always look on the internet for graphics or pictures and stuff like that, and I don't really ever think about it. So I just grabbed, and someone actually had a picture of a girl in her bikini cooking Thanksgiving dinner, and I thought, oh, that's a perfect picture to put with that post, and it didn't say copyrighted or anything on the picture, so I just copied and pasted it and put it in my post. So I get this email from this girl, I don't even know where she's at, she's probably out in Arizona or something like that, and she's like, remove that picture immediately. That's a copyrighted idea or whatever. I'm like, oh gosh. I was yeah. And then I emailed her back. I'm like, I'm so sorry. I was just trying to be funny and cute, and I wasn't meaning to do anything bad. So now we're going to collaborate on a project together. So there you go. Yeah, everything happens for a reason. Get new dishes. Just the thought of going to Pottery Barn and buying some cute little Christmas dishes or something, but get the saucer size so that when you eat your meal, you won't fill up a big plate kind of thing, and you can kind of feel good about your presentation on your pretty little plate, and then you're less likely to eat more stuff. But you can't go back for seconds. That's the only kicker with that.
It'd be funny if I had all the weight I would lose, 40 of those lined up on my table, and then take one away.
That's a great idea. Yeah, you could probably get a discount for ordering.
I know.
You could just buy the 40-pound one and walk away.
Walk away at it, yeah.
We don't do, over the past few years, we haven't done a Christmas dinner. We just do sandwiches and veggie tray and stuff, so that everybody can play with their toys and stuff, and we don't have to worry about cooking
and clean up. Oh
yeah, it's paper plates and that type of stuff, so that we don't have a lot to clean up, and
that's a great idea.
It's just been easier. It's less stressful.
Because it's about the family being together and the experience. Yeah, great idea. Anybody else? Any struggles, concerns? Everybody on track with what they want to be doing? And
I was having I was doing really good until my boss stressed out today. On the way over here, I kept thinking, holy, I'm going to stop and get a candy bar. I'm going to stop and get a donut. I just stopped and got coffee.
I guess did you?
It's
it's about making better choices.
Oh my God, I was ready to shoot myself. And the guy that was in town, he's like, if you're going to shoot him, wait until I'm gone. I said, nobody is worth going to jail over. And he's like, well, I figured you'd shoot yourself when you were done. I said, probably.
Have I ever done that little experiment with you guys where we think of somebody that bothers you, and then you think of can you think of 3 things that you like?
He's
about
really
that
not
person?
a bad guy. He just gets really stressed out when things are not because it's end of the year, and he's not thinking he's going to make his numbers, and he gets stressed out, and you could just see that his head's going to explode or something. You could just see it in him. And then of course he wants, and he's a control freak on top of that. So then he's looking over my shoulders, and it's like, oh my God, I've told you 100 times you didn't meet the number. So it's just, we went to lunch, to have lunch, and then he went home because his chest was all tight, and I was like, get it out there.
I almost feel sorry for him. He's making himself.
Well, I know. I don't feel sorry. I don't feel sorry for him because he brings it on himself because he gets stressed so easily.
He's doing it to himself. That's true.
And then he calls me after, I left work at 3. I shut my computer down. I'm out of there. And he calls me and he's all nice. Then I'm like, he obviously went home and drank a beer or something. He's all better now. Because it's just so. It'll be good tomorrow.
Good for you. You just got a coffee. That's good. I don't even want to know what's in that coffee though.
It's just a non-fat latte. I
There you
don't
go.
drink all the foo-foo-y coffees. My friend drinks those peppermint mochas, and she has like 5 pumps of peppermint in it, in a small one. And she got an extra one, and she goes, "You want this one?" And I'm like, "Okay, I'll try it." And I was like, "Oh." I poured it out. It was
Oh.
nasty.
Peppermint coffee, I'm not sure I like that.
Mm-mm.
Interesting. Has anybody lost 20 pounds? Have you lost 20?
Not yet, but when I came yesterday and had my shot, they weighed me and I had lost 3 more pounds. So
Oh, good.
Yeah.
that's
great.
exciting for me because it's just been so hard. So it's going at about a pound a week, which
Well, that's good.
That's good.
yeah, I'm happy with that. So
So we just bought these little like bracelets. So we have like a 20 pound, 40 pound, 60 pound. This one little lady in class this morning, if she lost 60 pounds, she would have like a leg left. That would be it. She was like, I want that 60-pound bracelet. I'm like, I don't think so. Which was interesting because we were like talking about goal setting, and the last one on the SMART goal, or one of the ones is realistic. I'm like, no. No.
mm.
All right. Well, let's go to the meat of stuff, the genetics of obesity and leaky gut. So the genetics of obesity are really interesting to me, and we've talked about how the hormone goes into the cell and goes to the DNA and makes the protein get made that triggers whatever process needs to happen in the body. So it just makes sense that if those hormones aren't working properly, or if the DNA is, wired wrong, that you're going to have more of a propensity to obesity. And they have found specific links for specifically ghrelin and leptin. You guys ever heard of ghrelin and leptin?
Mm-hmm.
Ghrelin's just a fun word to say. So ghrelin is your hunger hormone. I kind of think that sounds kind of like a gremlin.
I was thinking the
Hunger
same thing.
gremlin. And leptin is the full. And interestingly, a couple of years ago, there was a big push to put leptin and stuff, and leptin supplements and stuff like that. But all the research has shown that the more leptin you give, the more obesity you have, because you become leptin resistant, just like you can become insulin resistant or anything else. So it was a nice idea, but it really didn't work. But both of those are found on, interestingly, it's my DNA, the same genetic locus as sleep. So, significant tie-in with adequate sleep and hunger, fullness hormones, and obesity. So, that's definitely connected. And we've talked about genetics versus epigenetics. Epigenetics is sort of the factory that you're born with. Epigenetics is what that factory makes, whether it's Barbie dolls or tops or shirts or whatever the case may be. So you can change what your factory makes, which is a beautiful thing. So just because you're stuck with faulty genetics doesn't mean that you can't make changes and make things happen. You guys ever heard me talk about MTHFR before? I put a post on Facebook one time and somebody came back and said, it sounded like something bad.
Yeah, it kind of looks like that.
It does.
Yes.
I was like, you obviously don't even know what I'm talking about, but anyway, the abbreviation is for methyl tetrahydrofolate reductase, which is an enzyme in this folic acid pathway. So I'll just tell you kind of an interesting little story. Back in my little female Doc Hollywood days, I moved back home to pay off my student loans, and it was literally one of those things where people brought their mail for you to read. So because you're like the only educated person in town, it was kind of crazy. it's sometimes surreal, you know, it's like, wow, this is my life. And interestingly, if you ever get really bored, I blogged every week for the newspaper, and I actually compiled those and put it in a book called A Year in My Life. So I think it's available on Amazon if you ever.
Isn't that, there's a movie, is it Doc
Hollywood.
where he's, have you seen that?
Yeah.
Michael J. Fox, was it kind of like
Yeah,
that?
yeah,
I
that's
love
what,
that
that's what I was
movie.
thinking.
I
Like
think he
Doc
kind of
Hollywood.
got like kidnapped into that town or something.
Yeah, he
it
had
was
to
kind of
stay,
crazy.
but
So
it
he
was
was
like surreal. He was like this big Hollywood doctor, and
Yeah.
he gets stuck in this small town. And it's kind of the way it felt sometimes. I mean, I swear those people would have let me have done brain surgery on them if I told them I could have. Literally, I had a lady one time fall and hit her head, and I wanted her to go. It was 40 minutes to the nearest town to the ER to go get a CT of her head, and she's like, "No, can't you just like poke a little hole in there, and let the pressure off?" I'm like, "No, I cannot."
Let me go in the garage and get my drill.
Yeah, right. Just a little Dremel or something. Oh my god. But so, you know, so I had lots of fun experiences, and I would get bored and need some challenge. So I sort of began to pride myself on, you know, since I was a good listener, I would listen to people's stories, and I would get really creative with finding diagnosis for these crazy things that they would have, and there'd be things they'd had their whole life that nobody could ever explain, and I'd be like, I'm going to figure this out. And I had a pathology teacher from med school that I'd call, and he's just kind of a crazy genius, and he'd help me kind of put things together, kind of like House. You watch House.
Mm-hmm.
And so, you know, I kind of got this reputation, and I had people driving from Springfield and all over the place saying, I've heard you can figure this out, you know. I'm like, yeah, bring it on, you know. So one day I had this lady, and she had had like 12 miscarriages. She'd had several blood clots in her legs, just sort of a metabolic nightmare, diabetes, inflammation, all sorts of things. Fibromyalgia, just sick all the time, didn't feel good. And then she'd had one, she had had one baby that had had all sorts of problems and issues, and made it to like maybe 3 to 6 months of life kind of thing, and just horrible story. Family history, genetics of all this crazy stuff, blood clots and like lupus, anticoagulants, and all this stuff. And so, you know, I got really investigative, and I found this thing called MTHFR, and sure enough, when I tested her, it was positive, and she had 2 copies of the gene. Oh boy, I was all, I'm just the smartest girl in the whole world. I just was like riveted. I thought, wow, this is great. Center of the Genetics people in Little Rock. The Centers for Disease, CDC, considers that a rare disease, and so I'm just like, oh, I'm just the bomb.com, and this is all cool. So anyway, the treatment is actually relatively easy. It's to give a specific form of not folic acid, but a variant of folic acid called folate. And so we got her on folate, and you know, she felt much better, and life was good. So fast forward a couple of years, and I'm in Springdale doing internal medicine in the pit of the hospital there at Northwest, and which I'm not sure exactly how all that came about to be, but anyway, so I had a hospital employee. Again, she had had like 8 miscarriages. She had had a baby with a hypoplastic heart that had died at like a month old. Tons of family history and stuff. And I'm like, hey, this sounds exactly like this other girl I had this time. So I checked her, and sure enough, that's what she had. And so she ended up going to Little Rock to the genetics counselor. And then as I started doing more and more research, I started finding more and more people on the internet saying that they had this. And so as I started testing people that I thought vaguely had some variation of, maybe they'd had a couple miscarriages or fertility issues, or maybe they had a lot of inflammation, early heart disease, people dying in their family in their 40s or 50s of heart attacks and that kind of thing, I check them. Sure enough, they all had it. And I'm like, this is not rare at all. And so it turns out that when you look and you know, do the research and stuff on the internet, it looks like about 60 to 70% of the Caucasian population have at least one of these genetic defects in this variation in this pathway. And what this pathway is it's your inability to metabolize basically B12 and folic acid or folate. So, and the easy thing is that if you give somebody metabolized B12 or metabolized folate, a lot of these problems get much better, they feel better, a lot of these chronic diseases go away, which is really interesting. One of the one here, the A1298C, is associated with chronic disease, and then the other one, the C677, is the one that's associated with a lot of cardiovascular, heart attacks, strokes, Alzheimer's, all that kind of stuff. So you can almost, attach the gene to the problems that people have, and if they have both genes, boy, I mean, they're just one of those people that has tons of problems. So the significance of that is that if a significant part of our population has a lot of inflammation and chronic disease and diabetes and obesity and all these things that are related, you have to wonder, what's going on here. Well, interestingly, if you look back at historically what happened about 30 years ago, they started seeing a rise in something called spina bifida. And spina bifida is just a defect in the neural tube, or the spinal cord as it's developing. And interestingly, I have both of these copies, and in my genes, I was born with a variant of spina bifida. I had a hole in the bottom of my spine that closed over as I was born, and then the autism thing is also associated with that. So my family is rich with this stuff. My dad died of a heart attack he had cancer too, but I mean, he had heart attacks when he was in his early 40s and 50s. So my family is ridden with all this stuff too, and I had no idea. So when they started seeing these neural tube defects, they said, well, what can we do to prevent this? And so some smart researcher looked at this pathway and said, oh, we can give people folic acid. And the problem was when they started fortifying the foods with folic acid, we started to see less spina bifida, but we started to see more cardiovascular disease, more inflammation, more diabetes, more obesity, and more autism, because they put the folic acid in there, but they didn't put the B12 in there to equal it out. And so we see tons of issues with B12. And that's one of the reasons why the B12 shots are so important to me in this practice, because so many people are walking around with subclinical B12 deficiencies, and especially if you're overweight or you have this propensity to this genetic defect, you got to get that B12 in. So there's an issue with B12 is how you absorb B vitamins, because folate's just another B vitamin, how you absorb your B vitamins, and then what the B vitamin does as it gets into the cell, into the DNA, into the ATP, into this process where the cell breathes and does what it does. So a lot of people have leaky gut. We're going to talk about that in a minute. So they don't absorb their vitamins and nutrients very well anyway. But then the problem is, even if you do get it past the gut, if it can't work in the cell in this little pathway adequately, if you have that genetic defect, it doesn't do you any good. So, and I have a little paragraph here, and this is really interesting. It's right above the folate, B12, and iron. It says, there's growing concern worldwide that prenatal high folic acid in the presence of low vitamin B12 causes epigenetic changes in the unborn, predisposing them to metabolic syndromes, central adiposity, which is central obesity, adult diseases such as type 2 diabetes. Another active area of research and concern is that either too much or too little folic acid in utero causes epigenetic changes to the brain, leading to autism spectrum disorders. So, we thought we were doing a good thing, putting the folic acid in things. So, whether it's too little or too much of the wrong thing. Because the interesting thing is, in this pathway, folic acid, if that enzyme deficiency exists, folic acid accumulates as something called homocysteine. Have you guys ever heard of that? Mm-hmm. And homocysteine is very toxic at high levels. And in fact, I would argue, you've probably heard my spiel on cholesterol, but cholesterol really has very little to do with heart disease. Instead of checking cholesterol levels on everybody that comes in with heart attacks and strokes, we should be checking homocysteine levels, because this is something we can actually do something about and can actually change the course of disease with heart attacks and strokes. So very important that this does not accumulate as a toxic byproduct. Normal homocysteine is vital for processes, but too much it accumulates, so not a good thing. And there's a complex interaction between folate, the B vitamins, and iron as well. So an iron deficiency can mask a B12 or a folate deficiency. And you certainly don't want to give folate without B12, because you can have problems with masking certain things as well. So when I talk about folate and the difference between folic acid, I talked about hormones, and when I draw all my little pictures with the little houses and octagons with the little hydrogen and oxygen molecules, it's not all that much different, but it's different enough to cause problems. The form that you specifically want to take is not folic acid because that accumulates, but it's L-methylfolate. And that is what's in our supplements, because not folic acid. A lot of multivitamins will have folic acid and stuff. A lot of prenatal vitamins, they put a ton of folic acid in there. So, interestingly, the process is how I actually met Dr. Buell in Fayetteville, where our Fayetteville office is that he specializes in diseases of the eye associated with MTHFR. And I had a few patients who had done some research on the internet and found that he was working with that too and had gone to see him. And he has almost completely reversed macular degeneration. I don't know if you're familiar with that, but that's considered an incurable eye disease. It's inflammation in the retina. And so it's just amazing because he has actually patented his own form of L-methylfolate. And we call it eye folate because he's an eye doctor. And we carry that here, but it's also in our supplements too. But I have some people who have severe issues with MTHFR who will megadose them with the eye folate because it's got a lot more of the L-methylfolate in it, so that's really important. Also, just since we're talking about B vitamins and specifically things like B12, there are certain vitamins that you can't buy the cheap stuff. It's really important, like fish oil, because basically bad fish oil is just literally wring the fish into a capsule. They're not really doing any specific process to get the omega-3s out. Same thing with folic acid. I mean, it's cheap, it's easy to produce, that's why they used it. This is a lot more expensive, so, but you're really gonna hurt yourself if you're taking folic acid versus the L-methylfolate. This is just an isomer of methylfolate, which is metabolized well. I like to use the terminology ABC gum, like ABC methylfolate, because it's already been chewed, because it's like already metabolized folate. It doesn't have to do anything. Once it gets in, it knows where to go and what to do. B12, interestingly, if you buy cheap B12 over the counter and you look on the label, it'll say cyanocobalamin. You guys ever heard that term before? The cyano part is actually a cyanide molecule. So you'd say, why would anybody put cyanide, that's poison, in with my B12? It's because it's a cheap preservative. It's kind of like, why would you put mercury in vaccinations? It's because it's cheap and it makes it have a long shelf life. So your B12 is probably still B12 3 years from now as it is, you know, the day they make it. It's a lot more expensive to do methylcobalamin, which is what we have in our supplements and in our mix shots. And we have a very low shelf life, so if our expiration is literally, I think it's like 4 weeks, maybe 6 weeks on our methyl, and we throw it away. I mean, once the expiration date, we throw it away because it's not got as long a half-life. So it's a little more expensive, but you know, to me, it's so totally worth it, because if you have a compromised liver at all, especially if you're taking the oral form of this, you're going to get some cyanide products. So just so many things that, you know, we take vitamins thinking we're doing a good thing. You go buy a multivitamin and you're getting cyanide and you're getting, you know, all sorts of crazy things in there that you don't want to get.
Is there anything wrong with, I mean, I take the eye folate, obviously there's some supplements, but I also take a prenatal vitamin, so is there anything wrong with getting the folic acid in the prenatal vitamin? Should I avoid a prenatal vitamin that has?
Yep.
So how do I?
We can separate all that out, and we can get you the adequate iron and all those things that you need, but I don't know of any prenatal vitamins that actually have methylfolate. We might need to do some research for that, but yeah, folic acid is.
So just any form of folic acid, however I take it, is just bad. I mean, if I'm taking it even with the I'm folate, it's still not good for me.
It could still accumulate as the homocysteine. So,
okay.
Yeah.
So how do you know what to take? Because I've still been doing that because I just figure I still need to take a prenatal vitamin as long as I'm trying to get pregnant. But.
Yeah, I would stop it, and then, you know, we can talk about any kind of different things you need, and we can even do a nutritional assessment and do blood levels for your iron and different things and see where you're at with things. But the whole reason you take prenatal vitamins is to get folic acid, which is what they think you need. So but it's really, in my opinion, the wrong stuff, so, yeah.
Okay.
And if you're taking the methylfolate, that's probably all you need as far as.
So is that the
prenatal
same
goes.
as with the B12? I mean, if I don't, I know I have one of those genes. So if I'm taking B12 apart from what's in the shot because it's in the multivitamin,
Mhm.
is that bad too?
Yeah, well, I mean, you
still,
could be literally getting some cyanide if it's the cyanocobalamin.
okay.
I know.
It's like when you think you're doing good, it's
You
like,
do.
man, I'm shooting myself in the foot and I didn't even know it.
You do, and that's so much about our whole culture, our whole medical. I mean, because most doctors would go, "Oh, you need prenatal vitamins." I mean, there was a time when I even prescribed prenatal vitamins, thinking, I was doing the right thing. So,
Mm.
but and then if you're iron slow, you definitely probably need some extra iron and that sort of thing. I'm working on my next project is to have a good multivitamin because everybody always asks me what should I take for a multivitamin, and I don't want you to get the bad stuff. So I'm going to try to work on getting some private label that I put together with all the things that I think are essential, because our metabolic support has the methylfolate and the methylcobalamin in it, and it's got magnesium and all that stuff. So you're getting a lot of what you need in there. But still, there's some things like vitamin D's not in there, and some of the other essentials, calcium, which a lot of women need.
So
So I'm working
vitamin
on
D
that.
over the counter, we should go ahead and still take that then?
The D, yeah.
Okay.
Most of the D's are good. Some vitamins you can get away with the cheap stuff. The vitamin D, as long as you get vitamin D3,
Yeah.
you can get away with that pretty cheap. Magnesium you can get away with pretty cheap. There's just a few, like the fish oil and the B vitamins. Really, you need the quality stuff. I just have a couple things since we talked about the B12 shots. We also have 3 different amino acids in there: methionine, inositol, and choline, and basically those just help in the fat burning process. It kind of gets down in the DNA at that level where the ATP is burned. So, and then there's just a little bit more information about how it actually works in there. And then what comes with a leaky gut. That just sounds bad, doesn't it?
Yeah.
Well, a discussion on leaky gut is not complete without a discussion about food allergies. How are you guys doing on your food allergies?
Pretty good.
What'd she say?
Food allergies.
What'd she
How are
say
we
about
doing?
how are we
How we
doing?
doing now?
Oh, pretty good most of the time.
Let's see if I can find another colored pencil.
I'm exhausted.
It was hard today. I hope it at least
Couldn't go to sleep
get
last
some
night.
freezing rain tomorrow so I don't have to go to the office.
Needs to happen before school starts
yeah.
because
It's
that
so
is
I
a
know. Once
nightmare.
school
It
It's
is a
gonna
nightmare.
stink.
It is awful.
It is so bad.
Well,
So
because
bad.
some of the schools get out so early, like at 2:30, by the time you get the buses and everything, it's already 2:30. So it's like,
Oh,
why
it's
They're
can't
just
you?
predicting it
awful.
like at 9 o'clock, so we're
Yeah,
just
it's
gonna get to
just bad.
school
Yeah, it's bad.
I know.
and trying to get them all
Need not
home.
have.
It's supposed to last all day too. I mean, just we keep coming.
Mhm.
We should just close it before it starts.
They don't do it that way here.
No, they don't.
That would be just too.
Oh, I know, I've seen it like sleeting and pouring snow, 4 inches on the ground, and the buses are still running on that one. Why don't they just call it? It's not getting any
Remember
better.
that day at the high school, it was sleeting so bad. We like to never got everybody home.
It's bad.
Yeah.
You don't feel like you can leave till all your kids are home,
Mhm.
till they're gone and
Well, look what happened last year. Was it school down in Elkins or someplace like that, where parents, the buses couldn't even run. Parents had to go get their kids from the school.
oh, that's happened in Bentonville a time or two too, and
Yeah.
those parents are not happy.
My husband's already told work from home the next 2 days. He's from Utah. He was saying, it's fine.
Yeah.
I'll do work from home.
That's always crazy,
Yeah.
Expect that. Okay. So, food allergies, we talked about that before. Let's just kind of review that a little bit. You eat a peanut and you have an allergic reaction, that's immediate, it happens within 15 minutes or so. That's something called an IgE reaction. And that's a food particle, little protein on the piece of food called an antigen. And then you have an antibody reaction to that. Here's the antibody. Antibody comes and fights that, just like you would a cold or flu or a virus or stomach bug or whatever. And so this is the antibody. And the antibodies are called different things. If the antibody is called IgE, it's an immediate reaction, happens quickly. You're at the hospital getting an epinephrine shot, that's my syringe, and, you know, or on the ventilator if it's bad enough. If the antibody is IgG, that can take up to 72 hours. And so that's what we test for on your food allergy panels, like if the 100 different food proteins and your IgG against that. And if it reacts in the tube, then they rate that response 1, 2, or 3. So the food particle, as it goes into the gut, your intestinal lining is made up of, if we looked at it under a microscope, nice little cells. And these cells are all connected by these little collagen connectors. And there's these, all these little layers in the cells where the capillaries, or I wish I had red, but anyway, blood vessels run through here. So as the food nutrients get broke down and they kind of pass through here, the nutrients, your B vitamins, all that kind of stuff goes into the capillaries, and you get your nutrients, and that's a normal process. So here's a piece of food. Let's see, this is a piece of celery or something that you just ate, okay? Gets broken down. Now the process in the gut is multifactorial. How that happens is you have bacteria in there, and part of the process of the bacteria is to break down the food into smaller particles and break down the nutrients in the B12 and stuff like that. So people like with pernicious anemia, sometimes they don't have the right structure and are not able to use bacteria adequately to break down their B12, and they'll get red blood cells that are big and fat and all sorts of anemic problems and stuff like that. So the bacteria flora is very important. And we normally have this balance between bacteria and yeast in here, and as long as the bacteria are balanced in the right proportion, we're good. And they found that the difference between thin people and heavy people is the type of bacteria that's in there as well. So it's not just the bacteria in the yeast, but it's the type of bacteria. And unfortunately, if you think yogurt is healthy, if it's not on your allergy list and you think I'll eat yogurt to be healthy, unfortunately our Western yogurt here, or cow's milk yogurt, has the wrong proportion of bacteria. So it might help your bowels be a little more healthy as far as food moving through, but it's not really helping you as far as your weight goes, because it's just a different balance.
So what are you supposed to eat instead of
yogurt? Well, if you want to get that balance back, you need to do probiotics, but there are specific probiotics that you want to do. So they've shown that the balance of bacteria is, there's a bacteria called Bacteroides and Lactobacillus.
Oh, they talk about that on that commercial for Activia.
Yeah, and a couple different strains of that. So the difference is in heavy people, they have more lactobacillus and Bacteroides, and thin people, it's just the opposite. So you want to have the right balance, and the problem with yogurt is it's the balance that you would find in a heavy person, so that's not helping you any. Our probiotics that are in our Advocare are the right balance, and there's also another one called Garden of Life. And I'd like to invite you, if any of you can come next Tuesday night. The Garden of Life rep is coming to talk to the group on Tuesday night, so if you want to come, they're going to have some free samples and stuff, I believe. But their specific probiotic is called Primal Defense. And that class time is the same as our class time. And you can still come to your class too, but if you want to come to that one too, that'd be a good one to come to. But it's called Primal Defense. And they have it at Rogers Health Food Store, because that's where I've been getting mine. I want to carry it here eventually, but we just kind of haven't got on board with affiliate with them yet. So you want to have the right bacteria and the right bacteria to yeast ratio as well.
And you said they carry it where? At the
Rogers Natural Food
On
Store.
Thursday.
On 13th.
On 13th, yeah, they're great over
Oh, I
there.
didn't know they were still there.
Mm-hmm. I love that place, yeah.
So all that activity in my refrigerator is another one of those times I thought I was doing right and I wasn't. Okay. I'm glad I told
You don't know what you don't
I
know.
know, this is good to know.
Gosh.
It's a conspiracy they're trying to keep.
It
us from
is, it
knowing.
sounds
She
like
is
that.
trying to help
Break
us.
this conspiracy.
Maybe I'm just crazy. Do the research yourself. This is my understanding. The world according to Tammy.
I like this world.
You know, so the question is, who do you listen to? But, you know, when you look around and you see all the other things that people are trying to do that aren't working, you gotta ask, why is that not working? And why do people keep doing the same thing, expecting different results? So to me, it's about, you know, getting this knowledge base that there's a different way to think about things, because obviously we're, you know, missing something. Pancreatic enzymes. Now here's the deal. Y'all know the pancreas, okay? So if you draw a person, I love to draw people, and draw the stomach. The pancreas sits on the left side, and it secretes enzymes into the intestine. I drew it a little bit high, but into the intestine. And also the gallbladder has a little duct in there too, and this is called a common bile duct. And so enzymes come into the intestines to break down the food. So now we have not just this big piece of celery, but we have little pieces of celery as the enzymes break this down. And there's 3 different enzymes essentially. There's lipase, breaks down fat. That's the Latin term for fat is lipase. Amylase breaks down sugar. And proteinase breaks down protein. And these are the main ones. So if your pancreas has insulin resistance, and you can't make your insulin, it also, we call it endocrine and exocrine function. It's the only gland that does 2 different things like that. It makes your pancreatic enzymes and your insulin. So if your insulin is impaired, or your insulin's not working well, or you're diabetic, you got like a pretty good chance that it's not making your digestive enzymes either. And so we'll get a lot of gas and bloating and all that kind of stuff. So if you're not breaking down these food particles very good, here's what happens. Over time, if we take antibiotics and we wipe out the bacteria that helps out in this process, or we take some ibuprofen, and now we have like a big hole here, because ibuprofen and aspirin eats big holes in here. Or, you know, we have some stress and we get some ulcerations from too much cortisol in the gut, not enough serotonin in there. Now we have these big gaps and we've lost this connectivity. And also there's a layer of, just like antibodies, there's another layer of antibody protection called IgA. It kind of puts a little wall here to protect this. So our immune system gets stressed and we lose that barrier as well. So what happens is now, if we don't have the enzymes to break that food down, a big piece of celery goes in here, and now we have larger arteries running through here, not just the little capillaries that absorb the nutrients, but now the food is literally being exposed to the bloodstream in a way it was never supposed to be exposed to the bloodstream. And this breakdown in the gut, this leaky gut syndrome, happens over years. So that's why kids don't really have a whole lot of problems with food sensitivities, but as we age and time, this happens. And to me, this is the root of all hormone imbalance. This is the root. You know, we have some genetic issues and stuff, but this is the root, truly what we eat. Medicine is food, food is medicine. And so if you're eating the wrong things and you have this sick gut over time that's not working, it's just a setup for metabolic disease and all sorts of inflammation to happen. So when the immune system gets confused, now we start to see lots of autoimmune conditions. Autoimmune means the immune system is eating itself now because it's completely confused. It's not supposed to be fighting food. We're supposed to be able to eat food. And the problem is that we eat things that are not food. We eat cooked food or charred food. You've heard of, you know, the grilled food that's like almost burnt. We're really not supposed to eat meat protein. It's really hard for us to digest meat protein because it just doesn't break down well. Proteinase is the least amount of the enzymes that's secreted, so we don't break our meat down very well. And then, you know, all of this is just kind of set up for autoimmune disorders, autoimmune thyroid, autoimmune arthritis, rheumatoid arthritis, all those things. So it all happens, it all starts in the gut. So, so if your pancreatic enzymes aren't working, your bacterial flora is not working, and you've got all these little micro ulcerations, it's just this setup for leaky gut. So a couple things you can do. Have y'all heard of BINO?
Mm-hmm.
BINO is pancreatic enzymes. Beano is specifically mostly a pancreatic enzyme called amylase because beans are mostly carbohydrate. So and they have protein too, but so it's mostly kind of targeted to break that down. So what that does is it decreases the particle size so that it's more easily digested and you don't get the gas and bloating when you eat the beans. Also get the same effect if you soak the beans overnight because now they don't have so much like gas buildup in them and stuff like that, so much that the bacteria have to eat away on. So what you can do to heal this leaky gut up is a couple different things. One is you can take pancreatic enzymes, and we have those here in supplement, or you get them at the health food store. You can take the right probiotic, and there's also something called glutamine. Glutamine is an amino acid. It's great for muscle soreness if you're working out, really helps a lot with muscle soreness. But glutamine acts to sort of put a barrier over here. I call this gut spackling. Have you ever got a hole in the wall before and you spackled over it? Glutamine works just like that in the gut. So these three things can be really, really powerful. So I'd say you could just take Beano, but you're not going to get all the enzymes that you need in Beano. You really need to take the pancreatic enzymes. There's a ton of research if you Google pancreatic enzymes and inflammation, because inflammation starts in the gut. Actually, I can't write upside down, but so if you have arthritis, one of the best things that you can do besides take omega-3s and fish oil is pancreatic enzymes, and that's usually part of our holistic program for helping inflammation and
And you
joints.
said you have those?
So you have put all of them here, or?
We do. I don't have this Garden of Life here yet, but we have the Advocare probiotics. But I really, if I was going to spend the money, if you're done with your cleanse, because the probiotics and the cleanse only last you like 10 days, I'd run over to Rogers and get